is Nadisha in Chicago, and you are watching my channel, Knowledge for Quality of Life. Friends, as I said in the past, many times in my vlogs, that this channel is about sharing the best practice and my experiences over the years in various things. Today, I'm going to share something. It was very important at that time, and it is, and it's regarding the inguinal hernia repair. I went through this, and I'm sure that a lot of people in the United States and various parts of the world, they go through the similar issue. And there are various procedures out there, and what I chose and how I chose a particular procedure, and I want to illustrate or share my thoughts, here in this vlog. Back in 2019, actually earlier 2019, I noticed a little bulge in around my inguinal canal and inguinal area, and it was very subtle, and it was unnoticeable almost. But I just wanted to make sure that it was not usual to me, so I made an appointment with my primary care doctor, and when he looked at it, he said that, I don't see it. But, when I gave him a particular stretching posture, and he noticed it, and it was very subtle. It was confirmed by him that it was very subtle, and I can wait. There's no imminent need to do the repair. But he gave me a, referral for the specialist surgeon. I consulted the surgeon, and surgeon said the same thing, that, it's not imminent need. I can still wait, and, it's there. And basically, the surgeon gave me an option of repairing this inguinal hernia with wire mesh. And as a second opinion, I consulted another surgeon, and another surgeon said the same thing, that, it's going to be repaired using the wire mesh. And I was vividly researching the literature that, because I have heard and many complaints about wire mesh things, issues regarding a wire mesh hernia repair, and there are a lot of pending lawsuits and all that. So I was a little bit concerned that, I need to come up with something or do something which is very reliable. And while doing the research, I came across a paper at National Institute of Health, regarding the Shouldice repair. Dr. 𝗏𝗏𝗏𝗏𝗏, established a hospital of repairing the hernias using the Shouldice repair. Basically, Shouldice repair is nothing but it's using your own tissues, basically, rather than using the wire mesh. So it's a no wire mesh option. And the more I read about it, it just clicked with me that this is the option I should go with, and the recurrence rate is less than 1%, means success rate is phenomenal. So by the time I started looking for the surgeons in the Chicagoland area, I couldn't find one, and there were a few like in Boston, Ohio, and it was out of my area, so I was having a little bit restrictions from the insurance. Then finally, I decided that I'm going to go with the Shouldice Hospital in outside the Toronto, Canada. But the pandemic happened, and they were not taking any new patients from out of the country. So I was out of luck at that time. Still looking vividly on the internet and searching for the doctor, and luckily I found one in downtown area of Chicago, who was affiliated with Northwestern University, the surgeon, and I met the surgeon, and I kind of was impressed, and I made 2 more appointments following the initial appointment with all my questions and concerns, and he was patiently clear all my concerns, and he answered each and everything whatever I was asking. I was asking too many things. Sometimes doctor get offended, but this surgeon was very patient, and he answered each and every questions asked by me. So I was very happy with that. And, finally, I scheduled a surgery in 2021 around June time, and it was done. So I wanted to, basically share with you this procedure that, this procedure is out there. And if somebody is experiencing this issue, it means that, there is a non-mesh option available as well. So let me share my screen and, give you some thoughts, the bullet points, so that, before I go into the detail of my actual procedure. So basically, Shouldice repair is a natural tissue. As I said, it's a hernia repair technique, involves suturing the abdominal wall. So what happens that abdominal wall sometimes, it's by birth defect. Who knows? Sometimes, you do the heavy lifting. It could be a reason for that. Sometimes it's a by birth, and you noticed as the time goes by. So the abdominal wall gets ruptured, and your intestine area protrude outside, and in worst case scenario, it can strangulate, and things can get complicated. But I was not having those issues. It was very subtle. So basically, you have a weak abdominal wall, and the intestine portion of the intestines protrude and comes out. So what they do in this, they strengthen your own. They use your own tissues and strengthen the tissue wall. And push back the abdominal wall, and then suture it in a way that it's reinforced in 4-layer techniques. That's the whole idea about this Shouldice repair, without using the mesh, of course, to reinforce the weak area and prevent recurrence. It's a basically natural tissue repair. The Shouldice repair focuses on using patient's own tissue, so there is no complication as such, that because when you use wire mesh, you are using a foreign object into your body. And sometimes, when the tissue grows, it creates a, issue sometimes, if it doesn't jive with your body, because, it's a foreign object. So I wanted to avoid that. And, that's how I decided I wanted to get this thing repaired using my own tissue. So basically, this is what natural tissue repair is all about. Unlike the other mesh techniques which uses the synthetic mesh. This is a 4-layer reconstruction technique using the abdominal wall, 4 layers, using the sutures, creating a strong and reinforced abdominal wall. So it becomes like a very strong, so that the recurrence rate, it doesn't limit your ability to do sports athletic ability or whatever you are doing. It's overlapping layers, just like surgeon overlaps the layer of tissues, similar to buttoning a coat. It's reinforcing, just like, if you have a torn cloth and, you are suturing it in many places. This is particularly, it's done in 4 layers to strengthen the abdominal wall and reinforce the weak spot, so that where the hernia was developed. Permanent sutures, these are permanent sutures, and they use particular type of sutures. These details was given to me by surgeon, that what kind of a suture, what kind of a millimeter thickness, what kind of a diameter of the sutures. I was asking all these questions. And that's why I said that, the surgeon was so patient that, patiently answered each and every question which was asked by me. This is a non-tension technique, so basically, in wire mesh, because wire mesh is put, and that suture at a couple of areas, but the tension is there, and tension is taken by the wire mesh. But here there is no wire mesh, so your abdominal wall is repaired and sutured in a way that in 4 layers, so that it becomes a one unit, and there is no tension. So it means that intestine is not going to push it the way it would push the wire mesh. So this is purely a non-tension technique. Through exploration, thorough exploration, Shouldice surgeons thoroughly explore the area and of any weaknesses in the surrounding area before they do the permanent solution in suturing the technique of the abdominal wall. Now, this is done in local anesthesia. And there are requirements, because when you meet a surgeon and you are evaluated as an individual, because whatever my experience was, I'm sharing here, it may vary from person to person. Because when I said to the surgeon that, I wanted to do in level 4, level 4 is like a sedation which will put you in the twilight zone. You are not completely knocked out, just like a general anesthesia. And one of the requirement for level 4 sedation was, it was explained by a surgeon that, you have to have a low BMI. Means you don't have, that much belly fat. And I was very skinny to begin with. My BMI was less than 21, so I was declared as an ideal candidate for that. So, I chose to go a level 4 because the recovery time is much faster, because by the time they take you out of the surgery, you are awake. And, you are ready to, wear your clothes and, take some rest, and they give you a juice or some snack, light snack, and then you are on the way to your home. Let me share my screen here. So basically, on the day I went for surgery, I was accompanied by my son. We checked in, and it was a completely outpatient type of thing. I didn't stay in the hospital. And they take your all vitals. Surgeon comes, meet with you for any questions you may have. And they take you. The procedure was about 45 minutes. And it was done in a way that, it's about a 3 centimeters long cut. It's an open wound incision, because Shouldice repair is normally done in open wound. It's not meant for laparoscopic. And I'm okay. I was okay with that. And, I chose to go with the open incision. So they didn't, put the sutures or staple on the outside skin. They glue it normally nowadays. Sometimes surgeon, it depends on surgeon, and it depends on the person to person based on individual condition. So mine was glued, and after 2-3 weeks, the glue just goes away, and the skin is completely joint as if there was no bulge at all. The perfection is amazing, and you can see just a fine line where the incision was, but there's no bulge. There's no difference in elevation for the skin. It's fused so well that, body does its own job of curing and through the cell repair mechanism. After, the surgery, you are limited to take a little bit easy, so that you don't put too much pressure on the area of surgery. I was told that, try to sleep straight in a soldier's position, which I was not used to it. But now, with that experience, now I'm sleeping straight all the time. And it's an ideal condition anyways to sleep, if you can. The other thing is that, it was painful for a couple of days. I was given a codeine for pain medication, but I didn't take one. My tolerance level is, I'm blessed that, my tolerance level is a little bit higher than normal people. So I didn't take any codeine. I let it, heal itself, let it ride. It was a little bit uncomfortable, painful, but, I managed it. The one thing which I would caution that, any kind of surgery, whenever you have some sort of anesthesia given, whether it's a general or local, you will get constipated. And constipation is a big issue because, when you pass your bowel movement, you don't want to force it because your surgery is pretty fresh, and any extra pressure can open the wound. So your bowel movement should move freely without any excessive pressure. And I was badly constipated, and doctor gave me a suppository, but it didn't work. Nothing worked, to be honest with you. And then finally, I recall my background of magnesium. So I asked my son that, get me from Walgreens or CVS magnesium citrate bottle. It's about, I believe, 10-ounce bottle. And I took half of it. It's a magnesium citrate solution. It comes in various flavor, lemon, cherry, whatever you like. It's available in plain without any flavor. So I chose the plain flavor, non-flavored, plain magnesium citrate. And I just took half of it. And within half an hour, I was relieved. And once you are relieved, it becomes normal based on your diet. So that was amazing experience. I'm very thankful. I put a very extensive my Google review for the doctor. This is my personal experience. I would strongly recommend people who are going through any kind of hernia repair to look for this option as well rather than mesh, because this option is available and a lot of people probably don't know about it. So I thought that I'm going to do a vlog on this, sharing my personal experience, and this is the option available so that people can benefit out of it. And have a discussion with your surgeon. And it's available now in various states. At least last time I checked, it was in Nevada, it was in Boston, Massachusetts, it's in Ohio as well, and many more. So look for this option if possible, so that you can make a good decision that what suits you and what's in best interest for you. I hope you learned something and share with people. You may not experience directly this issue, but your loved ones, your friends, your families, this is very helpful, as it was very helpful for me. See you next time. Bye.